Medicare Claims. 5 things you need to know. Hi, this is Cathy Bukowski. I'm the owner of CB Health Insurance, and this is the CB Health Insurance YouTube channel. And I'm very pleased that today we have a special guest with us. Her name is Holly Monger. She is the owner of HSM Insurance Consulting, and she's here to give you the 5 tips about what you need to know about Medicare claims. Now, before we get into that, Holly, I do want to introduce you, and I figured I'm just going to go ahead and ask you, can you tell me a little bit about who you are? Tell us about your company, how long you've been in business, and what you do for people.
About my company, I established my company in 1992 after a lot of family and friends had said, you need to start a business helping people with their health insurance claims because nobody understood. It was like reading tax code, they said. I don't understand any of this. And many people still don't. So that's why I started it. I continue to go along and help whoever I can with actually any type of health insurance claim. But there's a lot of Medicare and there's a lot of just standard groups, whatever they have.
I feel like, and I've sold group health insurance, that Medicare is the most complicated when it comes to claims. It seems like they just make it so confusing. So, what types of services or claims situations do you have, like specifically when it comes to Medicare? Give us an example of maybe somebody that you helped with a Medicare claim.
Oh, I have so many examples. Some people contact me because they're seriously ill and they don't have time to watch how Medicare paid their claims, how their secondary, if they have standard Medicare, paid their claims. So they want me to audit their claims, could be on a weekly basis, on a monthly basis, and report back to them.
Got
And
it.
part of that agreement is they let me know if they've received any bills from any of the providers, so I can tell them exactly what to do with those. I have other people that I go back and it's called the order of benefit determination. And that's when somebody has coverage under a group health insurance plan and they file for disability. And unfortunately, what happens with disability is they tend to backdate coverage. Well, here you are, you have all these claims that were paid for months, and you have to go back and get them reprocessed, and it can be a nightmare. So,
Because they're now eligible for Medicare and before they were on the group plan, right? Is
right,
that part of it?
right.
Oh boy. So when it flips that switch, it gets screwed up.
It gets screwed up. There's overpayments. It's trying to get the providers on the right track and where they need to refile all those claims.
Ay, 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 ay. That's a lot of work. I'm glad you're doing it, not me. So this channel is dedicated to Medicare, and we wanted to focus on Medicare claims specifically. So you and I talked about this because there's some really key things I do tell people, but I learned some things from you I never knew. And we talked about there's 5 important things that you want to share with the audience today. So let's start with number 1.
Setting up your online presence. So if you have standard Medicare, you need to establish an online presence with an ID and password, and it's just www.mymedicare.gov. And you register, and then you get to go into the website and you learn all sorts of things. If you have a Medicare Advantage plan, you're going to have to make an online presence with perhaps United Healthcare, or maybe it was Aetna or Humana or whatever plan that you have. But you need to make that online presence so you can go in a nanosecond when you're having a problem with the bill and you can figure out exactly what's going on with that claim, who paid what, when, and where.
Instead of picking up the phone and waiting for 2
5 hours.
hours with
Yes.
1-800, yeah, Medicare. Yeah,
Yes.
that's no bueno, no good. So that establishing an online presence, online account, what is number 2, would you say?
It's called a release of information, HIPAA authorization, standard authorization. For your Medicare Advantage plans, you have to go back to the company and you have to ask them for the form typically because they don't always have it online. You ask them for the release of information form so you can indicate a loved one that can contact them when you can't.
Wow.
So
Yeah.
once somebody gets sick and they're unable to call, nobody else can without you giving verbal permission or having it in writing. Medicare Advantage plans, however, they go according to their own guidelines and typically only last a year. If you have standard Medicare, you can go to your online presence and you can type in your authorized representative. And that representative, you have up to 5 representatives that you can indicate, and it is good for life.
Wow.
So you
So
never have
if
to.
kids are, because we have this situation, well, I did this for my mom, but if kids are helping their parents are in their 80s, maybe they don't have a computer or they're not computer savvy, and mom and dad are getting dementia and they can't. And I know Medicare, if you don't turn on your electronic notifications, you just get gobs and gobs of EOBs and info in the mail. It's really hard to sort through. So you can elect somebody if you're on original Medicare for life to
Yes,
be your contact. And wow, so they can call Medicare on your behalf. They can check claims. They can do all of that.
yes,
That's huge. So that's number 2 is release of information. You're designating somebody else. You're giving them
yes.
authority. Okay. So what's number 3
Number 3,
suggestion?
understanding the order of benefits. And what I mean by that, people go on to, you're coming off a group plan or an individual plan, and you have one insurance carrier to deal with.
Mhm.
When you go on to Medicare, you have a decision to either choose Medicare Standard or Medicare Advantage. If you
Mhm.
choose Medicare Advantage, which many people do, it's because the premiums are so cheap, but be careful because the benefits aren't always so great. Medicare Advantage to me is for somebody that is perfectly healthy and you best not get sick. But when you go into standard Medicare, you are basically signing up with Medicare under mymedicare.gov. And
Mhm.
then you have to obtain what's called a Part B coverage. And that could be United Healthcare, whatever coverage that you find. Mutual of Omaha, I forget all
Medicare
their.
supplement, right?
Yeah,
Is that
Medicare
what, yeah.
supplement.
Mhm.
And there is an order. So once you have Medicare, Medicare is always primary
Mhm.
unless you run into a situation where you're still covered under a spouse's insurance and he or she is still working. It's an order of benefits, and you have to be very careful with that. You need to make sure you understand when you are eligible for Medicare, you know exactly who's primary and who's secondary.
Yeah, that is, and I'm sure, the onus is on the individual too, to make sure, like, if you're retiring in the middle of the summer, for example, not the end of the year, January 1, and now you're coming from a group plan, now Medicare is primary, you need to make sure when you go to the doctor's office, you're giving them the correct
Correct.
cards as
Yes.
well, right? So if you're on
Yes.
original Medicare, it's original Medicare plus the supplement. If it's on Medicare Advantage, give them that card. So
Correct.
the order of benefits. Okay,
Well,
so
there's also one more situation I want to bring up
yeah.
because it's something that people don't think about. When you have a slip and fall or you're in a car accident, that's liability insurance, auto insurance. And when Medicare finds out about it, if the claims are filed to Medicare, they want their money back through that auto carrier or the liability carrier. And they're going to lock up your claims until
Mhm.
that's settled and it's straightened out.
Yeah. Okay.
So be very careful of that situation also.
Got it. So important things we need to know. Number 4, what would you say is another important thing people need to know about Medicare claims?
Understanding your Medicare summary notices. So, and it says clearly this is not a bill at the top. This is what you'll get with standard Medicare. How to read those, and they're not easy.
And those are the EOBs, we call them EOBs, explanation of benefits. Is that what you're
Right.
referring to? Yeah.
But Medicare calls them Medicare summary notices.
Interesting. So it's
Yes.
different terminology, but the same thing.
Right. And it's this lovely little form. It's going to tell you who the provider is, the date of service. It's going to tell you the total charge, what Medicare allowed, because if the provider accepts Medicare, then he or she reduces their charge to whatever Medicare says is allowed. Then what they do is they calculate it and they pay 80% of their allowable. And then they're going to show what you owe. Now, it may automatically be submitted to your supplemental, but that supplemental should be picking up that whole amount. Now, there are situations where they don't. And there's little codes, little alphabet, A, B, C, D, all the way up. And there's statements at the bottom that explain what they mean. And it's going to tell you what's not covered.
You know,
So you
it's
have to pay
interesting.
attention to those.
We had a client call our office. We switched her from Medicare Supplement Plan F as in Frank to G as in giraffe, because she's 85, going to be 86 soon. And the premium was really, really high. And we said,
Yeah.
you have to meet a deductible. And so she was getting billed by different providers and said, "Hey, what is this all about? I've never had to pay before." She forgot she has a deductible. We saved her $600 a year, but she has to pay a 250. Now she's had how many months of claims? We're in June, and she had March, April. And so I said, you have to look at the EOB, and she was trying to send it to us. Oh my goodness, these codes, they can they make them any smaller for people
Yeah.
to try to find? So I'm sure this is you just have to help people like read these to
Right.
understand what's covered, what's not. And a lot of times they freak out because what's not covered, but they don't know this, they're not responsible for. Just because they bill up here and Medicare pays down here doesn't mean that the patient is necessarily responsible for that
Well,
balance,
that's true.
correct?
And that Medicare summary notice will tell you you're not responsible for this,
Okay,
especially if nobody told you in that provider's office that it was not covered.
right.
So
Yeah, yeah.
the other thing is when you have a deductible for your plan Gs, so it goes to your secondary carrier with the standard Medicare, and let's say it's United Healthcare, or no, let's say it's Blue Cross Blue Shield, because Blue Cross Blue Shield gets it and they'll send you their EOB. But all it's going to state is that they denied it. Doesn't tell you it went to the deductible. It doesn't tell you anything. It just says denied, which is
Oh, get out.
horrendous.
That is horrendous.
Well, and what,
That's disturbing. Do they want
yes.
people to call? Oh boy. Okay.
Well, and you need to understand that you have your secondary, your supplemental, or even Medicare Advantage. You're going back to the carriers, and they
Mhm.
created these EOBs for individual and group policies. They weren't really thinking about Medicare because it's a smaller population than what they
Yeah,
can have out there. So they
interesting.
don't make changes specific to Medicare. So you
Got
have to be
it.
careful of that. And you have to, what I do is I match up. If it's a standard Medicare, I match up the Medicare summary notice with that supplemental EOB. If it's Medicare Advantage, it's just one statement.
Got it. Yeah. Yeah. So number 4 would be understanding and knowing how to read your EOBs or your summary of benefits, as they call it
Right.
with Medicare. So number 5, last but not least, what is very important that people should know about Medicare claims?
Why you should not pay that provider until you get those Medicare summary notices and EOBs from your
This is my
insurance.
favorite one. It's not my favorite one, actually, signing up and having somebody else be the authority, because I've done that for my mom and dad. But gosh, we tell this to people all the time. You're
Yeah.
not supposed to be balance billed. So, and it seems like more and more these days, sorry, I'm interrupting you, but these large conglomerates of
Yes.
doctors groups and hospital groups, they just spit bills out. And I tell people, don't pay that bill. My mom was paying bills she was getting from the provider. I said, Mom, you already met your deductible. You have a supplement that pays 100%. Stop paying this. But she just went and paid it. So
Right.
yes, make sure. So number 5 is to not pay the providers when you get a bill. Make sure that it's been processed
Sure.
correctly. Is that what it is? Yeah.
Well, that's what it is. And you want to make sure that you're not paying them. And trust me, there's providers out there that they want their money within 30 days, but for you to get it back, they say, well, it's going to take 3 months. Excuse me? That's ridiculous.
It
But
is.
you want to make sure that you really owe that money.
Right. Yeah. No, it's so important to do that. And sometimes they don't even get around to billing right away. So, there's definitely a delay. So we've gone over the five things, but we've been talking about Medicare, right? And in general, but you mentioned something that I talk about on my channel all the time, which is there's one of two options. You either do original Medicare with a supplement and a Part D drug card, or you do Medicare Advantage. And for many, many years, the supplement was the majority. Now it's about 50-50 nationwide. I want to ask you, do you see a difference in how claims are processed and which one has more issues? A
Oh, yeah, there's a
long
difference.
question, right?
There is a difference. Claims processing, well, everything's electronic nowadays. And, everything goes to Medicare first when you have the standard Medicare, and they process the claim, and then it just rolls over into the secondary or supplemental.
Mhm.
Medicare Advantage just has that one submission, but I've had many clients come to me with problems. They didn't understand why something was denied. One of the biggest issues has been somebody falls, God forbid, breaks a hip, something like that. They have to go into rehab. And they're in there for a week, and suddenly someone comes and says, well, we're not going to pay for it anymore. Your insurance isn't going to pay for it after the week. What do you mean they're not going to pay for it? And there are so many things that go into that. I've been in one situation where the husband was trying to appeal, and his wife had multiple issues, and they kept saying, well, there's no reason to prolong it. She needs to be, discharged. There's no way she could be discharged. And it basically went to a judge. So you have an appeals process that it goes before a judge. And the insurance carrier looked up information in the books on when you can deny and how you can deny. And they were following to the letter and applying the most stringent rule they could, and they cut off the benefits. And then his wife died.
Horrible story.
Yeah, it was
Yeah.
it was absolutely awful. And they weren't willing to negotiate. They weren't willing to work with anybody. And the
Mhm.
the problem is between the facility and the carrier. So the facility gets notified, and they're throwing paperwork in front of you and saying, sign this, because now it's a self-pay. It's like, whoa, wait a minute here. And you really don't know what you're signing because you are so upset of what's going on. And facilities need to get involved quicker and start an appeal process, because that's where it starts. Quite often it's because of physical therapy,
Mhm.
and the physical therapy notes are not documented properly. And the doctors don't understand always that, okay, you've gone through the 2 weeks of this kind of therapy. Now you have to change the order and make it the next step. So it is a constant watch to make, because they want to see that you progress.
Right.
And
Yeah.
when it, yeah,
Yes, if you plateaued, you're not getting better. That's what happened to my dad. He was on original Medicare, not a Medicare Advantage. And after a hospitalization, went to skilled care. And of course, Medicare only pays up to 100 days, but it's not guaranteed. You have to be
right.
getting better. And he never walked again. We actually asked for one more week. We appealed. They approved it. We worked with the facility, but after a month, he had to be transferred to the temporary side. Yeah. Yeah, he needed round the clock care. So let me ask you another question, because this is along the lines of Medicare Advantage. And I've like I said, I have people that come to me and say, oh, I heard this is terrible. Well, it's not terrible for everybody. It depends on your situation. Certainly, people with there are certain types of people that this product is good for. Definitely, if
Yes.
you're in low income, it coordinates with Medicare, Medicaid. And if your budget and you can't afford a Medicare supplement, this is a good option. My question is this, because I see a huge difference, even in the group marketplace, between a PPO and an HMO. And when I came into the business, Medicare Advantage was HMO only, which is very restrictive. Small networks, you have to sign up for a doctor, you must get a referral. If you go out of network, you have no benefits. Do you see a difference in how the claims are processed? Do you have less problems if somebody was on a PPO, for example, or you've seen more issues with HMOs?
I see my clients are more PPO than HMO because too
Interesting.
many of them have said, I am not going to play mother, may I go to see this doctor.
Hmm.
They want more control over their health. And the
Sure.
process that it takes under an HMO is much more difficult.
Hmm. Yeah.
So I don't see that as much. I will tell you though, I wanted to kind of put a plug in for people that have a loved one that goes into a facility, skilled nursing, nursing home, whatever. I advise people all the time. First of all, make sure that your authorization is on file at that facility and you are the main contact. You want access to all medical records. And if you are not keeping up to date with the care of your loved one, then you make weekly meetings with the doctors or nurses or whoever, and you make sure that you are following what they're doing. Because if you don't, you're going to be blindsided a lot of times with facing, we're kicking your mom or dad out of the facility. So be prepared.
This becomes a full-time job. Anybody that's dealt with
Yes.
aging parents, and I think time is, and especially for people who don't know what questions to ask, how to do this. So, do you work with people? I know we're in Illinois, but do you work with people across the country? And how would someone go about contacting you if they needed assistance? Because what I think you're telling me is, look, you can't always do this yourself. You need to hire, sometimes you need to hire people to help you, or at least get some advice, point you in the right direction if there is a problem with claims or whatnot.
Contacting me, you either call my phone number or you can email me.
Okay.
Um, I have a website out there that HSM claims it .com.
Yeah.
And you can see the phone number or the website and the email address. You can also Google me, HSM Insurance Consulting. If I don't get back to you right away, I will get back to you. Just leave a message, or I will respond as soon as I possibly can. And I've worked with people, oh goodness, New York, Florida,
California.
California, yeah.
Mhm.
People will call me from anywhere, and if I can help them, I will. I
Yeah.
will tell you though that there's some situations that I have to say, I'm sorry, I can't help you because the laws are so different in their particular situation. For example, I had one that mom was in a facility and they signed her up for California Medicaid, which
Mm.
I knew nothing about. So I couldn't help them on that particular piece.
Got it. Yeah. I That's the thing. It is so Medicare by itself is complicated, and then there are different products on the
Yes,
Medicare side because I'm a Medicare agent, so I sell Medicare Advantage plans and drug coverage, but it varies by state.
right.
And then different states have different laws, and Medicaid is a whole different animal that I am not familiar with. But I appreciate your time. This, hopefully, people found this helpful. Medicare claims, 5 important things that you need to know. Don't forget, we will put Holly's information up on the screen here. Feel free to reach out and talk to her if you need assistance. She's been doing this a long time. She is an expert. There is a fee involved, just so you know. She doesn't work for free, but feel free to reach out. And until next time, don't forget to tell your family and friends, give us a thumbs up and subscribe. See you later. Cathy Bukowski, CB Health Insurance. Thanks for being with us, Holly.
Thank you.
All right. Have a good day.